Hi, may I speak with Mr. Smith, please? Yes, this is Ashling, the nurse practitioner calling from the office. I was just giving you a call. I had received a message that you were having, worse reflux symptoms. And so I just wanted to talk with you about a few things. We might need to make a few medication changes if you have a moment. All right, great. So I wanted to call and talk with you about a medication called omeprazole. You may have heard of this medication. You might hear it on TV. You might also hear it called by its brand name, which is Prilosec. The medicine is often used to treat acid reflux, or what we refer to as GERD, like you and I have talked about, which is when stomach acid moves up into your food pipe and causes heartburn, discomfort, or even damage over time. And so my understanding is that you've been taking Pepcid over the counter for a month, and that this really hasn't helped those symptoms. Is that right? Right. And so since you mentioned that the Pepcid hasn't helped much, what we would like to do is try something stronger, and that would be the omeprazole. And omeprazole, it's a different class of medication. It's what we call a proton pump inhibitor, or PPI for short. And so omeprazole the way that it works is by turning off tiny pumps in your stomach that make acid. These pumps are called proton pumps, and when they're blocked, your stomach makes less acid. And this gives your body time to heal and stops that burning feeling that you have in your chest and your throat. And so unlike Pepcid, which blocks acid after it's made, omeprazole actually helps stop acid from being made in the first place. And so let's talk about kind of what happens whenever you take this medication. Let's break it down as to what happens whenever you take omeprazole. So you're going to take this medication by mouth. It's just a pill that you take by mouth once a day. And what it'll do is it'll get absorbed into your small intestine. It works best if you take it in the morning before you eat. And then what happens is that it travels through your bloodstream and heads straight to your stomach acid pumps. Your liver will break it down by using specific enzymes, and then it leaves your body through your kidneys and your bowels, but mostly leaves your body in your urine. It starts to work within a few hours, but it can definitely take a few days for you to feel the full relief from the medication, and that's totally expected. I'm going to start you on 20 milligrams once a day, and I want you to take it 30 to 60 minutes before breakfast. I want you to take this dose for 4 weeks. What we'll do is we'll reassess your symptoms after the 4 weeks and see how you're feeling. If your symptoms are still there, we may extend your treatment for an additional 4 weeks. And then if there's still no improvement after the 8 weeks, we can either consider increasing your dose to 40 milligrams once a day for an additional 4 weeks. But if your symptoms get worse during that treatment, or if they don't improve after increasing the dose, we should talk about referring you to a specialist called a gastroenterologist. And that's just a physician that specializes in this area. And so even if you feel better after the 4 weeks are up, it's very important that you continue taking the medication for the full time that we've prescribed. Stopping the medication too soon can actually cause symptoms to return, or it can slow your healing. So most people do well on omeprazole, but like all medications, there can be side effects. Common side effects of this medication include headache, stomach pain, gas or bloating, nausea, diarrhea, or constipation. And then there's some rare but serious side effects, especially if you use the medication for a long period of time. And what this includes is you can have a low magnesium level, which can cause cramps or heart rhythm issues. You can have bone thinning or fractures, vitamin B12 deficiency, so it would be low. Your vitamin B12 levels would be low, and an increased risk of certain gut infections. So it is important that you contact the office and notify me if you feel weak, dizzy, have muscle cramps, or any unusual bowel pattern changes. Sometimes there's reasons that patients shouldn't take medications at all. And for this medication, really the only reason you shouldn't take it is if you're hypersensitive to the medication's ingredients. I don't have any record that you have hypersensitivity to any of these ingredients and any known allergies, and so it is safe for us to proceed, and we'll just keep an eye on that. Medications can affect certain age groups differently, and so, for example, sometimes you have to be mindful of, say, the kids, that population. This medicine has been determined to be safe for children as young as 1 year of age. And so it's important to know that. Now, medications can also affect older patients. And because you're 60 years old, there are a few extra things that we should keep in mind. Long-term use in older adults may have an increased risk of bone fractures. So we'll want to use the lowest dose for the shortest period of time. It may also lower your magnesium level or your B12 levels over time. And so what we'll do is we'll keep an eye on that with lab work should we have to keep you on the medication longer than 8 to 12 weeks. It is important that you always let us know if you're on any other medications because omeprazole can interact with some other medications such as blood thinners like Plavix or certain anti-seizure medications. So please notify the office should any of your other providers start you on any new medications so we can make sure that those don't interact. So omeprazole, it's a great tool to help your stomach heal and to reduce your symptoms of reflux when others really haven't worked. And so we're using it to give your body time to heal and to prevent future problems. Just as a reminder, a few things to remember with regards to what we talked about. I do want you to take this medication just once a day before breakfast. Don't crush it or chew the pill, and be sure to keep taking your medication again for the full 4 weeks, even if you start to feel better. And if you ever have any concerns, any side effects, or any questions, please don't hesitate to contact me.